Thank you very much. So we should have a picture. I can see it there. Is it going to come there? Please come. There we go.
Oh.
So Anca is responsible for the picture, so she's going to have to explain what she thought. It would be interesting in terms of doing that panel or breaking down the barriers to healthcare innovation. So the floor is yours.
Yeah, well, we had something scripted, like word by word.
Yeah.
No, we haven't. But then I flew over from Zurich to London, and I saw this right before I embarked on my plane. And it got me thinking long and deep, because I have been asked this question ever since before the pandemic, then after the pandemic, in several contexts, mostly in health tech contexts. So less on the side of health policy, but more on the side of, need-led innovation. And I was like, it's not enough to understand your point. It took me a while. I actually read it several times. And I was thinking something, and now I would like to ask you, this is completely improvised. It's not scripted by Dexter. So by a raise of hands, how many of you have been actually contacted by your bank at any point of time with something that in the end turned out to be very useful and appealing and interesting and seemed like it really read your mind? I have.
Don't be shy. I know it's a number of serial killer. Don't be shy.
No, they're just tired. This session.
Yeah. But, yeah.
Yeah, so the question was then, how many of us have been actually called by a GP or a health system, a healthcare provider that anticipated our needs and asked anything about your world, not just yourself, that would help fine-tune your patient journey. Even though you're not a patient today, you could be. And I think the answer to that is easy. I'm not going to ask you to raise hands. I know you're tired. But that's really sad. And we all have lived the hype of the pandemic. And after the pandemic, the surge of health tech and digital innovation afterwards. And we like to say, and we tend to say a lot, that it's the wave is still there, and we're still doing a lot. But I think it kind of slightly lost the momentum, and we're still not anticipating much in healthcare. We're still providing sick care. We're still being reactive. And this ad coming from banking proves once again that the same as before the pandemic, fintech is one step ahead. Not that we're competing, but you get my point. Fintech is still one step ahead, and we're still talking about changing mind shifts, challenging the status quo, paradigm shifts, and changing cultures. And the question is why?
I guess the question is based on that ad is, what exactly can the healthcare sector learn from other industries in terms of making sure it embraces innovation? Do you want to go? Don't be scared.
Yeah.
Go on, Lucy.
Yeah, I can give it a go. Firstly, thank you for everyone sticking around to the last panel of the day. Well done. You made it.
We don't even have drinks afterwards.
People still here, but
impressive.
Yeah, I mean, in 2008, we had the financial crisis. And then shortly afterwards, I think there was a project called Project Innovate, which was led by some really forward-thinking regulators in the FCA. And as a result, we have a booming fintech market in the UK. So I like to think that, like, out of crisis and need, some really forward-thinking progression in regulation can really create a market that thrives. We heard from Lawrence and Alistair this morning. I think there is the right leadership in place to create that. So like the regulatory sandbox was an initiative in Project Innovate and brought forward some incredible fintech companies. And they had this really fundamental thing called the consumer duty, which meant that fintech had to be serving the consumers first. They had to build in kind of the consumer duty to everything they built. I would love to see a consumer duty or patient duty kind of factored into the regulatory sandboxes that they are trying to deliver at MHRA.
Scott.
Yeah, I'd love to. I love that. Firstly, that thought about sort of never waste a good crisis. I heard that from Reid Hoffman a few months ago when I went to listen to a talk. He was talking about the US state of play at the moment, but you're connecting it to COVID. It feels like a really good time now to innovation to come out of. I think the only thing I'd build on around learning from fintech is it's kind of a lesson where fintech's been over the last 5 years. You can almost say it's been unbundled, and we're in the stage of unbundling a lot of health tech, like a lot of niche services, a lot of applications that do one thing really well. And fintech did that exceptionally well, services that just did investing really well or did mortgages really well, but it created a lot of customer lack of really understanding what's going on in my finances. And now we're seeing that, the fintech space and finance space rebundle services, bring things closer together to help consumers navigate that. And I think that's interesting for the health space now, where it does feel like everything's unbundling right now. When do disconnected apps become systems? And that's where there's real opportunity, I think.
Can I kind of follow up and ask a question? And tell me if it's a silly question, but one of the things that I kind of thought about when I saw the picture was of SpaceX. Not that I think of Elon Musk on a regular basis, but I was thinking SpaceX, they do rockets, a lot of them fails. Doesn't matter, it's a private company. NASA, which is a public body, if it were to do the same thing, every time a rocket were to fail, everybody would go on their case saying you're wasting public money. So is it the case that because healthcare is still very much public, there is still that kind of vision that you can't really move fast and break things in the healthcare sector because it's public money in many cases, and it's also a matter of life and death. If Elon Musk loses a few billions on a rocket, who cares? If NASA does it, it's public money, it's your taxpayers' money. It's not life and death, but you care a bit more. If it comes to healthcare, it's something different. So are we seeing kind of barriers to innovation in healthcare because healthcare is very, very specific in terms of what it does or it's funded and basically the outcome, and therefore it's very unique, or have I got completely the wrong end of the stick?
I can have a go if you want to.
Please.
I think we can learn a lot about how AI is being regulated in other sectors. So AI is non-deterministic, as we know. So it is, a dynamic and evolving product. This is not the first time that we have regulated or tried to control or tried to adopt technology that has outstripped our understanding. And there's, you wouldn't buy a car that hasn't been through a quality assurance mechanism. The crash dummies testing whether or not it would survive at different velocities. I represent a company called Coalition for Health AI. We are building a quality assurance ecosystem in the US. Don't let the accent fool you. I'm actually defected to America for the time being. I think there are several things you can actually do to control or at least, create a kind of post-market surveillance network of the tools in practice so that you can have, some level of confidence that it works at the point of deployment, and then, continually monitoring and governing that technology through many of the assurance resource companies that we certify within CHAI. So at some point there will be a network within the US and hopefully globally if we're able to kind of take this out of the US, which is you can track how all these models are working with a level of confidence and be able to respond immediately when things hallucinate or drop in accuracy. So I think the risk of the AI, it needs to be balanced, obviously, to protect patients. But I think there are several things that we can learn from quality assurance that's been happening for decades, which means we can have confidence in the tools, regardless of whether or not we have full knowledge of how they've been trained.
Scott, Anca?
I was gonna, just to maybe build on what Lucy was saying. As a former ISO QMS auditor myself, I think it really is embedded in seeing the lives at stake from, the concept of what you can't measure. You can't really see the impact it has. So in healthcare innovation, it's so easy to just point the fingers when something doesn't work. Whereas in other industries, in other sectors, you don't see the lives at stake. So it's a different angle that you're looking at. So I think this could be main barrier when saying why we are reluctant to healthcare innovation, which barriers we need to break. And regardless, I think we're making strides by bringing more stakeholders at the same table when we're talking about engineers sitting, and we just saw on the panel beforehand, right? We had engineers, medical doctors, designers, and working hand in hand is not shifting the attention or the focus from the human's lives at stake, but it's kind of giving the whole picture into what healthcare innovation can do and how far it can go. And on the other hand side, minimizing the risks by keeping in mind everything that's at stake.
Firstly, I think Elon's such an anomaly that he gets a lot of undeserved leniency. So I don't know how much most of us can learn from how he gets away with a lot of things. Firstly, but my broader point is that I think what the companies that do, or the applications, the services, the organizations that do really well, is just have a relentless focus on the problem at stake and the user at the heart of it. And so if you solve a problem or you solve that particular barrier, you can cut through, even if you're a complex, large organization through to a startup with a vision.
Yeah, I mean, that's interesting. So my analogy wasn't quite right, but not completely wrong either. That's fine. I'm used to it. Don't worry about it. Let's kind of maybe move on in terms of what can actually be done in terms of trying to break those barriers and make sure we have innovation. When we kind of prepared the talk before, and Lucy, you said something quite interesting in terms that you felt we kind of needed to put standards over pilots. And that's quite interesting because I think a lot of people would think we need to do a pilot to see whether that technology or that particular service works.
I don't remember.
You did say that, if I read you properly. Or maybe you didn't, if you didn't tell me
No,
I'm wrong.
right.
But maybe in terms of standards, I think you put kind of standards as being kind of a critical element in terms of making sure you kind of scale up solution and do different things. So why do you think standards are very important in terms of that innovation journey, I guess?
Yeah, I think so. CHAI is 4,500 organizations in the US that cover all the health systems and all the tech companies that build the health systems. And a big part of what we do is we get 20 work groups looking at use cases or risk management frameworks or whatever the kind of thing is. And we get, hundreds of experts from across the industry into those work groups, and we write small S standards. We're not a government regulator. We're a kind of private sector-led self-regulatory effort in the US. And we've been doing this with the Joint Commission. If people know them, they accredit all the hospitals in the US. So once these standards are written, the hospitals then have to go and comply to those standards, and they'll be kind of certified to be responsible AI if they do so. And I think that is a really exciting kind of fertile ground for adoption, because I don't know if it's still the case because I've been out. I used to work at the NHS, but I would hazard a guess that we're still in kind of pilotitis for a lot of pilots. And I think a more kind of practical world that we're trying to build within CHAI is get everyone to sign off on the standards. And we've been doing this for the last few years, certify hospitals to that standard, and then certify the vendors to that standard. And then we're all building to the same set of criteria that we've all agreed upon. And then, whether it's a pilot or whether it's a, whatever you want to call it, at least there is a really clear route to kind of reimbursement and an adoption, rather than just like pilot for pilot's sake, which feels like a little bit of a easy way out to basically say no, and we're not going to pay for it. I think build to a standard, and then agree that if you're going to meet the requirements, that there needs to be a contract at the end of it.
I think this is going to sound sort of counterintuitive or can be challenged, but I think the idea of building a pilot, at least building it, is the barriers have been lower. So it's almost become easier to actually build a pilot. And you hear it from leaders within the private sector all the time. I've heard this statement before, like my 16-year-old can build applications now and all that kind of stuff. You get challenged that this is why Johnson & Johnson went from an approach of essentially a spray and pray with all of their Gen AI pilots the last 2 years to realizing we need to be more focused, because it comes down to actually getting it in the hands of users and getting it in the hands of clinicians is ultimately where the challenging part is. So I think there's been an over-pilotizing or over-confidence in the ability to build pilots that don't end up working, and we've gone back to the drawing board of needing to be more focused, needing to have a proper business case, needing to have a proper kind of user need at the heart of it as well.
And I think that kind of feeds into, the idea of collaboration amongst all of you. And I know at the WHO, obviously that's kind of a big element of what you do in terms of your initiative. So, Anca, what do you think collaboration rather, is key and critical in terms of breaking those barriers innovation? If you want to give a couple of examples of what you do as a WHO.
Absolutely.
Well.
Absolutely. We're humbly trying to lead by example in that, changing a little bit the side of the coin. My personal thoughts on this is just in general, success and healthcare innovation happens when organizations start competing in isolation. And we have seen amazing examples among hospitals, health tech companies, more and more examples like David mentioned before, WHO with regulatory agencies and so on. But I am particularly happy to share one of our top leading initiatives at the moment is the Strategic Partners Initiative for Data and Digital Health, where we are pioneering in the WHO in that sense, bringing together public actors, and by public actors I mean the member states that we are representing at the regional office for Europe, and together at the same table with the with the private sector, meaning even big tech companies. And I have to proudly say that because I have been also in health tech previously and working alongside them. And I was particularly happy to see policymakers, governments, health ministries discuss and talk the same language and sit at the same table. And then we have the civil society, which is by far one of the most important component, bringing in the not-for-profit and the patient's voice to some extent. We have there 4 working groups, 4 amazing working groups spread across these 3 fantastic sectors. And the one that I'm personally involved in is currently working on an AI solution, a federated model to actually reduce the burnout and the strain of the clinicians. And by that, we're looking at workflows, we're looking at secondary use of data. And I think I don't want to repeat myself and overly promise on the outcome of the working group. I mentioned this briefly yesterday in the panel, but we're hoping for great results that are going to be published in the end of this year, along a fantastic report, also published by our unit on the implementation of AI in the member states.
Before I open it up to questions for our remaining audience, and thank you very much for staying with us, sometimes we kind of get bogged down in terms of doing innovation for innovation's sake. Like, you do innovation, that's great. You do AI, your CEO can say you do AI, everybody's happy. But how do you make sure that actually that innovation gets into a proper outcome? I think when we discussed it with you, Scott, you kind of mentioned you need to have a clear workflow with measurable outcomes, and that's kind of critical. So maybe if you want to talk a bit more about clear
outcomes are really, really important. I think it's also building for the right people as well. I think the thing I'm most excited about AI, or one of the things I'm most excited about AI, is the shift in opening up accessibility. I was listening to a podcast the other day with Chris McCausland, who's the comedian who's blind, saying that to him it's the biggest innovation in like the ability to have AI talk through images that if you were a friend or a family member, you just get bored of. Like, there's amazing innovation coming through and making products accessible. So the kind of key barrier for me is making sure that anything we do from clinical trials to early stage product development has that inclusivity at the heart of it. And I think one of the most sort of damaging things we've had from sort of Silicon Valley sort of mindset is this idea of sort of first best user when it comes to developing products. And what that's meant is that who are the most first best users? It's people with money, people that live in urban environments. So it's created this massive wealth inequality that we have. Well, that's part of the reason behind it. So the thing I'm most excited about, the thing that I think innovation or AI innovation in particular will land with is making things more inclusive. And so that's what I'm excited to have opened up more than maybe traditionally or what we've seen in the past 20 years.
Lucy?
Yeah, I was just going to comment, I think, the new administration talks about winning the AI race and in the US, and I don't really know what the winner looks like. I don't know what at which point someone has declared a winner. It's much less clear than putting a man on the moon. But I think if we were to reorient the focus to be less around just more and more models coming out of different nations and actually try and prioritize pillars of trust as a way to kind of determine a winner. Just for people's awareness, the UN did an amazing report on kind of public trust in AI, and China's public trust in AI is 83%, and the US is 38%. So wonderfully different and exactly inverse. But I think the core things of how people, we talk about trust a lot, but what are some of the pillars? You want things to be reliable. If I was going to tell you your Excel spreadsheet is going to return the right answer 50% of the time, you just wouldn't use it. How can we get accuracy scores up to 100% and make that reliable? I think the second thing is around transparency. So, what does transparency really mean? It's who built the model? Who can I call if it goes wrong? Who is it trained on? How does it work across different populations? So Chai's built a nutrition label for models that actually give you some of that detail to say, it doesn't work on Hispanic speaking populations. Okay, great. Well, I'm not going to use that if I live in California. So there's that element. And then the third piece is the data even accessible to do that training and validation of AI? So those three pillars of where we want to build trust is the three pillars of Chai, and would really welcome people to join Chai, by the way. It's open to anyone who wants to join it. But yeah, that's the kind of world that we want to build, so that, as you say, it's not just the San Francisco and New York. It's in the context of Chai, it's the entirety of the US that can benefit from this population. And only through some of these tools that we're trying to build can you actually get to any level of trust in the tools. Yeah,
I would, again, building up on what Lucy was saying, I think the key moment or the key to building to achieving the trust in AI and in the tools that we're putting out there to serve the population and the clinician on the other hand side is proving and demonstrating that AI is a means to an end. It's not the solution. So the solution should already be something else, a real problem, and we saw that earlier on. So don't try to just solve smoke just because AI is a fancy word and it sounds good. It's all about validation and testing with real world problems.
Thank you. Any questions? There's a lady over there, and I think there's a gentleman over there. So I'm going to the lady first, and then a gentleman afterwards.
This is on? Yes. Thank you so much for your insights on this. My name is Caitlin Norris-Gray. I'm from Flagship Pioneering, which is a biotech company based in Boston. You mentioned about equity in terms of AI access. And I think that's a really interesting one because often you have to balance making sure that AI is equitable and that everyone who accesses healthcare can use it, including people who don't have smartphones, people who aren't educated in AI. And then also on the flip side, speed of uptake, which is both important for patients to improve their outcomes, but is also important for the UK and the EU as an AI powerhouse. So I was just interested in your thoughts about how you balance those two perspectives on AI.
And gentlemen, if you want to ask your question, and we'll take both at the same time.
Again, George Vredenberg from the Davos Alzheimer's Collaborative. I sort of see the world through the brain. As we know, brain health in WHO terms is not just the absence of disease, but the health and the flourishing and the productivity of the brain. So my question, I guess, is if AI is a tool to enhance the performance of the brain, the resilience of the brain, in education or in predictive models of what lifestyle changes we ought to take during life to prevent later life disease, are we going to try and regulate those as health products, or are we simply going to allow that space to take off wherever it goes without really ever testing the claims of the products that are put out there for brain resilience as opposed to suppression of disease?
Thank you. So equity and ease of access, who wants to go first?
I'm happy.
You go,
wanna
go,
go
I can follow. Yeah, go for it.
So the simple answer from where I stand would be health literacy. So there's several initiatives around the globe, not all of them through us, but many of them building on health literacy, just making sure that there are no marginalized community or anyone left behind, as in our credo in general, but not just that, like working hand on hand with the member states, making sure at the point of implementation of AI and technology in the respective country, when developing their strategies, that health literacy, regardless of age, race, it's actually an active component.
Lucy?
Yeah, on the equity piece, I think I probably learned the most about this, or like the examples that are coming to mind is we did a big research project with the SCAN Foundation, a big philanthropy that looks after California residents, but like their main focus is older adults. And older adults, as you mentioned, don't have access to phones a lot of the time. They might not even be able to see, like similar to the example you say. So like finding, if it's like voice agents or if it's basically like being a bit more inclusive about like the technologies that need to find the patient rather than like waiting for the patients to kind of find the technology. And so we did some amazing work with the SCAN Foundation to try and learn about like the hardest to reach and how AI would kind of serve them. And it's a similar problem to the debate around digital. Like it is really hard to find people who don't have access to services or literacy or all these things that you mentioned. But I think it's not undoable. It's the same problem that we've been trying to grapple with for decades. But I actually think that through kind of some of the testing and some of the data that is, there's suddenly a big effort for health systems to, clean up their data, understand their populations better, and actually really develop like precision services for each person within their field. And so you can actually shift some of the healthcare services upstream to be more preventative. The tools that you then use, whether it's like voice agents or others that can be more inclusive, that also need to be tested and validated on those populations. So I guess a long answer, but there's new focus on cleaning data and normalizing that data to actually make it sort of AI ready so that you can find that population. And there's a really, I think, continued effort from AI technology companies who are trying to find those patients to serve them. But equity is, a huge issue that is not going to be solved by AI, and it definitely is going to be exacerbated by it unless we put proper focus behind it. So agree with your point. I can't actually remember the brain one, sorry. But I'll pass over to you and I'll try to remember the answers.
Yeah, you'll have to remind me of that one as well. But just to add, I think there's fundamental flaws in most models that aren't inclusive, and those should be continued to be challenged and regulated. As someone that works for an organization that builds layers on top of models, I think that's where you can be more inclusive and accessible by being creative. And as you mentioned, like thinking about voice agents, we've just built a product for rural America using SMS technology, but with layering AI into SMS to deliver personalized messages. That's sort of a new tech combining with an old tech that is more accessible to most people. So there are creative ways that as builders or people in the private sector can make things more inclusive. Yeah. And
The question was on kind of AI and brain health in terms of whether it should be regulated or not. Isn't it? Resilience.
Contributing to brain resilience as a health claim is a regulated product.
No regulators on this panel, though.
Yeah, I'm not a regulator, so I can't really speak to it, but I think there's a really interesting kind of blurred line between wellness and clinical tools that has existed for a long time, like Apple Health. Apple Watches have previously, I think Aura is like mid legislate or mid kind of lawsuit around whether or not some of the claims they make are kind of wellness or clinical. So like it's an ongoing thing around where regulatory powers want to sit on that kind of paradigm. But I think as long as it depends. Like, if you're using ChatGPT, you can have like the loudest of disclosures underneath it to say this is not medical advice. But yet, in the middle of the night, if you've got nothing else, where are you going to go? You're not going to be able to call your mental health therapist. ChatGPT might be the only thing that you have. So, what can you do about that? You can, disclose as much as you like that it's not medical advice, but you can also try and control the inputs and create, better health recommendations from ChatGPT, because I think there's so many people going to it in the absence of nothing. So again, like not a very concise answer, but Shai is working really closely with a lot of the foundation models to improve the kind of medical accuracy of its outputs, as well as trying to educate patients on when to use it for wellness and prevention versus when not to. But yeah, it's not a clear answer, sorry.
I can answer from a very personal point of view, not related to regulation, but I really worry about this. It's related to sort of brain health, maybe. This whole idea of like cognitive offloading. Like I worry about it in my own job, being over reliant on simple tasks that can just be done. Write out some bullet points, make this make sense, send an email. But that whole process is using my brain and my mental abilities, and over reliance on a lot of these tools in work senses and also our health senses is, I think there is a worry of this whole idea of sort of cognitive offloading to AI to get the job done for us. So yeah, very personal point of view there.
That's a very good way to end up as Anca.
I also believe that over reliance on these tools, it's quite risky. We need to define a clear line between what's normal or decent reliance, say so, mostly in healthcare, and loved, by the way, the previous quote on the AI part and the continuation of it. So I think I actually read a couple days ago about the MHRA, who actually did AI as a medical device regulatory pathway a couple years ago, if I'm not mistaken. And I was planning to look more into that.
Thank you. I mean, the clock is ticking. I have to give some closing remarks, so I'll be very, very quick.